So my life in 5 minutes. I was born in Mexico City, a city girl, and I grew up until the age of 35, 33 in Mexico City, and then I immigrated to the United States. And what inspired me, it was my parents, of course, and there is not just a line, it's for real. Because my mother didn't want me to play with the adults. She said, that is the way that you grew up to be a mother and stay at home. I want you to do more. And I was like, I didn't know what more was, but I have that in my mind. And my father was a man that even, I'm talking about many years ago, he knew very well about sexual harassment. And he told me, you are going to get a career in the university and you are going to be your own boss. Because if you go to careers that are lower, you end up having affairs with your boss and they are going to harass you all the time. So with that, I think the message was you need to be independent and you need to grow to be to do things more than the traditional women, because I grew up in a very, very poor neighborhood. I mean, I'm talking about dirt streets, and the majority of people didn't have shoes and all that. So my parents didn't go to the university, but they encouraged us to go to the university. It was no way around. So all my family are doctors, lawyers, teachers, because it's the way that it was supposed to do. When I practiced medicine, I graduated as a medical doctor. I practiced medicine for about 5 years. And one day I realized that I was not doing my job, that the medicine that I had, it was not enough for the community. I did my social service and then I opened clinics in different small parts of Mexico, and it was always that nutrition. I didn't have the money to give food to the people. And the other, it was about the sanitary conditions. The majority were in infection diseases. I couldn't cure them. I mean, there will be people coming back again and again and every month with the same situation. So I was thinking what I'm doing. I have the opportunity to come to the United States to visit. And I saw the places and I said, what I'm doing in Mexico? What is it in there for me? And I knew that even undocumented, maybe I could live better here and then in Mexico. So I went back for my children and came back here by myself, undocumented. And I suffered all the abuse that I could. Even if you are educated, people don't see you that way. You have no history, no support. So I think I start just feeling sorry for myself, but more than anything, feeling sorry for the people that I knew that immigrated to the US with the hope to do better, and in reality, the price that they paid to support the families in Mexico. So I started in domestic violence, I started in sexual assault. I moved a little bit more to the area of health, because I said, I'm going to do something here with it. I mean, yeah, I passed the shock, right? The language barrier passed. So I said, now I need to do something. And it's how I came back with wonderful people who inspire me to do better. People who took me and said, Catalina, I'm going to give you a job here, but this is not your home. Your home is somewhere else. You will start here. People who sent me to training to learn about the system. Actually, I was a court advocate, which is totally different than what I was. To do counseling sessions. I learned as much as I could. And with that, I think eventually I became a person in the city that was representing the Latino community in different areas. I was named one of the 100 people most noticeable in the city. I was awarded and celebrated during the royal visit of Princess Diane. I became an advisor for the FDA and the National Cancer Institute. I was a patient advocate. And I just found that being an advocate was my passion. I have all the tools. I had very good education. What else? And I had the people behind me.
You are truly inspirational and aspirational. And in telling your story, you could see the lived experience that you give because entiendes tanto lo que otros han pasado y han tenido que sufrir, that they've lived and suffered and had to overcome. And then when they see you y todo lo que tú has podido cumplir, when they see you, de que se fueron, si ella puede, yo también. And that's huge.
That is so rewarding.
Absolutely.
When I see, because when I was at Northwestern University, I remember one young boy and said, "You are a doctor." And I said, "Yeah, I don't practice medicine, but I did my evaluation." And he said, "I always wanted to be a doctor." And you see this man who is extremely poor, with tattoos all over. And then I said, "What happened with that child to get to this point?" Because he had dreams. What happened in between that he couldn't accomplish that?
And very much like you said, maybe the person or persons weren't really seeing them, right?
Mm-hmm.
Like you said, when they weren't seeing you, they were, or they were just seeing, a stereotypical image of who you are. Where you, like so many, like all of us, we have many different layers. Maybe he didn't have that, and that's it. Now that's what you're doing. You're letting people who are in doubt have a moment of pause and say, no. Tú eres mucho más de lo que otros piensan de ti. Es tener la garra, right? You need to have the courage and the tenacity and maybe even the stubbornness to superarlo.
Stubbornness. I have been stubborn all my life. Persistent, stubborn. And right now with the patients that I see, I start working with them from the time that they are on dialysis, and I tell them, start studying. Study English. Go to a vocational school. I have this network with the schools and city colleges, and I'm always passing around information about what they need to be promoted, because some of them have been 20 years in the same position. The only reason that they are not supervisors is because they do not speak the language. So I tell them, go and study. We have actually 2 people who are starting to be dialysis technicians, because they have the information. They just need to get the degree. And yes.
Sí, todo se puede en la vida.
Todo
Tienes que tener la garra, sí se puede.